Hey everyone, welcome back to another episode of the RepPath Podcast series. Today we're in a makeshift setting. We're going to be in our permanent space soon, so please be aware. Bear with me for a couple of these sessions. We're moving back to Miami, so we're getting the Miami location set up this week. So again, new space, but whole point is we got some great content today, guys. We're going to be looking at switching from features and benefits to selling a value-based model. And how do you do that? How do you sell with value? Because we're so used to going out there talking to doctors about features and benefits. When you start your roles, no matter what company you're at, that's all you hear about. What are our features and benefits? What are our features and benefits? And then we get out there and start selling to doctors that way. And I'm going to tell you and show you why that's an issue and why that usually doesn't resonate with a lot of physicians. They don't think in features and benefits. They think about outcomes, okay? And that's what we're going to go over today. So before we get into that, as always, guys, some quick housekeeping. We are live today on YouTube, LinkedIn, Facebook, and Instagram. We're also on every podcast platform. For any of you that are looking for the recording of this podcast, as always, make sure you go to my YouTube channel, Unfiltered Medical Sales Coaching, so you can get all the content, not only with this episode or all previous episodes. And then any of you that are looking to break into the industry, we're real excited, guys. We got the RepPath Academy. So very simply, as we pop up here, this is the RepPath.com website. Just go on the website. It's very easy to use. You'll be able to navigate through that. So you can set up a call to learn more about the RepPath Academy. We're helping individuals every day break into this industry. So please go in there, sign up so we can help you too. All right, perfect. Excuse me. So today we are talking about moving from selling a feature-based model to selling a value-based model when you're talking to physicians. So all of us have started in training classes and you're selling a new product. First thing they're going to ask you, so what are the features and benefits of this product? It doesn't matter if it's a device, if it's a pharmaceutical product. We always think features, benefits. And at the end of the day, guys, it just doesn't work with physicians, okay? So if you're selling something that, for instance, when I started selling birth control, one of the features for our product was low estrogen. So our product had the lowest estrogen on the market, okay? So that is a feature. Though it was only 15 micrograms of estrogen. That was like half what the average birth control had, okay? That's a feature. So if you keep going around there, and I made this mistake, where I just went in there and said, it's low estrogen. Doctor, it's the lowest estrogen out there, 15 mics compared to 30 mics. And you're not really saying anything. You're just giving a feature, okay? When you get to the actual value, that's what does it mean to the doctor and the patient, okay? So less estrogen means low side effects, all right? That's the benefit, all right? So the feature, less estrogen, benefit, low side effects. Again, what is the value to the patient, all right? So this could be, so what it means to you is less time getting nauseous throughout your day. You don't have to interrupt your meals. You can eat what you want, because you're not going to be nauseous, and get those estrogenic side effects that can come with other birth control pills. Okay. That's the value to the patient. The value is the result. Okay. So it's not going to interrupt your day being nauseous. I mean, this is just a quick, simple explanation of going from features, benefits to the actual value and the outcome. So there's a big difference between outcome and the features and benefits. And the outcome is basically the real world. So what does that mean to me? All right. So if a doctor, think of this every time you're practicing your sales calls and you're practicing going over whatever product that you're selling today, what does it mean to the doctor? What does it mean to the patient? Okay, whoever your customer is, this is not even a medical sales topic. It could be any topic, guys. Okay, what does it mean to your customer? What is the real value for the customer? That's the important thing, guys. And that's how we want to start thinking. And the reason why we're doing this, and the reason why we're focusing, heavily focused on value, and not features and benefits, because the model has changed in medical sales from years past, where we went from a fee-for-service model to a value-based model. All right, so let's go over the differences between the two of them. Okay, so just pulling up some notes here. Okay, first off, when we're looking at fee-for-service models, okay, these are pretty straightforward, guys. This is the type of medicine we've been dealing with in the past. How a provider gets paid in a fee-for-service model. That's they do a procedure. The more they do, the more they earn. Okay, so for every XYZ procedure, they're going to get a certain dollar amount. The more of those they do, they're going to get more, X amount of money. They do 10 procedures, they're going to get paid for 10 procedures. But in a value-based model, it's based on outcomes and efficiency. So if they're not, it's not just about the volume. Okay, so they're rewarded for keeping patients healthy and reducing cost. All right. This is a much different mindset, guys. Okay. So if you just think of this, if it still was just all about fee for service and outcomes didn't matter, doctors would just constantly want the fastest, the quickest. How can they turn over as many patients as possible and just crank out procedures left and right? That would be the only concern. So all you would talk about is speed and efficiency. That's it all day long. Because dollar amount is just about we're talking about just the quantity of procedures, you're going to get more in. It's not the case. The results, the outcomes matter. So that's why it's a big difference. We can't just talk about speed, because the old fee-for-service model was all about just number of cases. Now it's not. It's about outcomes. So it's got to be about the quality, not just the quantity. Okay, and we're going to go over why it's an obvious reason why that's a big difference. But you got to really think that way, guys. You got to think like your customer. And the only way to think like your customer is knowing exactly what's going on with your customer, exactly how they get paid. If you don't have that understanding, you're going to shoot yourself in the foot, because you're going to be positioning questions and positioning your features, benefits, whatever your sales process is. You're going to present it in a way that's based on an old way of thinking. And that's going to be why you're not getting the responses that you hope for, because it's really not resonating with your customer. All right. If all of us here's a simple analogy. Let's think of, we all like to order pizza. You might have your favorite pizzeria for whatever reasons, and they could just sell features and benefits to you. We have the biggest pizza for the cheapest price. Those are the features. All right. If they're just talking about those features, they might not mean anything to you. There's no value to you in having a giant slice of pizza. All right. So you're not going to order that. Why? Because at the end of the day, you want the thing that brings you the most value, which is the best flavor. All right. So, but if someone's just telling me the features, it's big and it's cheap, what does that mean to me? I don't care. But I don't understand. I keep calling on this guy, Joe, telling him that it's big and cheap, and he still doesn't want to listen to me, because those are just features that have no value to me. Right. And that's why I don't get back to the person that calls me trying to get me to buy that pizza. It's the same thing with your doctors. If you're wondering, how come I'm telling the doctor, I've been in there every week telling them about all these features, I'm selling them like crazy, but he's not listening to me, because you're not listening to him. You haven't tried to find what the real driver is there. What's the real value, and sell towards that. All right. And I know it's a stupid analogy, but it's something to just think about, guys. Got to think and realize what your customers really want, because you can't sell anything unless you know that. That's the key. Before you even start talking about features and benefits, you got to probe and learn more and more about what those drivers are. We talk about that all the time, but this is really going to be evident during trying to sell in a value-based model. All right. So again, we talked about how they get paid with fee-for-service versus value-based. Incentive structure. So this is all fee for service is volume based. Value based is outcome driven. They're focusing on the quantity during fee for service. For value based, it's focused on quality. Now, the financial risk when you're looking at these two models changes drastically. Okay, so in the old model, so just think of this: fee for service. Every time they do a procedure, they get paid. So the risk, the financial risk, is based on the payer, the insurance company, Medicare. They bear the risk. It's because they pay for each claim. So the more you do, the more that they're going to pay for. Now with a newer mindset, newer model for value-based care, it's the provider, it's the healthcare, the clinician, the hospital. They share the financial risk because if the outcomes are poor and costs rise, the reimbursement is reduced. All right. So that's the major difference. Now the risk is on just the physician. It's shared now with the physician. It's not just all on the payer. All right. Big difference. That's key, guys. So an example of this for fee for service, a hospital is getting paid for every MRI, surgery, and lab test performed. For value-based, the hospital receives one bundle payment. Okay. And so if you're getting a knee replacement, they're going to get one bundle payment for everything associated with that knee replacement. So that's going to include the anesthesia. That can include the rehab, the hospital stay. Everything gets included. The more complications, the more things that make that process not go smoothly come out of that bundle payment. So the less they're going to receive. So a lot of times you'll hear people talk about readmission rates. Readmission rates are very important. A hospital does not want you to come back. When they do a procedure, they do not want you to come back. The more that you're coming back and you get readmitted, okay, that costs the hospital money. That eats into that bundled payment. So now they make less. If they're supposed to make $1,000 on a procedure, you got to come back. Trust me, that's going to drop drastically. That could go from $1,000 to hundreds of dollars to pennies to you possibly owing money. That's how big of a difference it is. So value-based care is here to stay. It's going to get more and more weighted towards the end results, as it should, because that's what we're here for. We're here for outcomes and results in healthcare. But we got to sell that way. All right. So to back up to where we were. Okay. So we talked a little about the differences. Just to go over again, we're talking about features. We're talking about the actual technical specs, the mechanisms. If it's a drug, that's a feature. The benefits. How does it help the physician or practice? Is it an easier workflow? Is there less downtime? And the value. The value here, we care about the impact on the patient. This is the outcome, the quality of care. Okay, so we're talking about a system. Say if it was a patient, we're talking about outcomes, quality of care. If it's the actual hospital system, we care about the efficiency, the reduced emissions, and the overall cost savings. All right. So what's key with this is we got to get better at storytelling using our data. That's the key. You got to be able to really drive that home. Whether you're using your clinical data, your published studies, your real world evidence, that data is there to prove the outcomes, okay, to improve those improved outcomes in live, real studied feedback. Okay. Then we also got to look at the economic data. So we're looking at those hospital stays, the complications, the efficiency. Okay. And then we got to translate all that into ROI language. All right. So for instance, for every for every dollar you spend, your hospital is going to receive $3 in readmission costs. All right. This is important, guys, because especially when you're selling into hospital systems and when you're selling higher ticket items, it costs too much. We don't have the money. We can't afford it. You're going to get that every single call. No hospital, no customer ever says, I have so much money, I don't know what to do with it, Joe. Thank God you came in today. I could spend more money on shit that I wasn't thinking of today. Never going to happen, guys. It's always, we don't have the money. It's too much. We don't have the bandwidth. We can't do this right now. So every time though, you got to break down, you got to show that value. You have to, and you have to show the ROI. So for instance, if you're selling, when we were selling robotics in the cardiac space, every time we talked about the cost of the product, because we're talking about a 7-figure plus system. Hospitals got to spend millions of dollars on this. Trust me, they're going to push back, right? But unless you show them the ROI. Now, one of the things for us was they'll be able to attract more patients because there's certain procedures that they normally wouldn't do at that hospital, or they wouldn't do, anywhere. But with our system, they would. So now it's attracting all these other patients. It's a whole nother revenue stream that the hospital never thought of. All right. So we have to make them see that. We have to show that value. And when we break that down, that yes, it does cost $1 million for this system, but your hospital is going to bring in X number of procedures that you normally wouldn't do, which will bring in, 3X million every year. So when they see that, okay, now it's an investment. Now it's not just about a one-time purchase that we're losing money on. No, the ROI is there. It makes sense. But the only way to do that was showing them the value, getting back to value. If I stick with features and benefits, my product is safer and it's it's a $2 million system and it's X amount size, but it's going to be safer. Again, it doesn't mean anything to them unless I show the overall value. Safety means that it's going to reduce 99% of your perforations in your hospital, which equals about $5 million a year. Now, I'm making up all these numbers just for the example, but you see what I'm saying now. I took it from just saying safer to what does safety mean? Okay, so now there's a dollar amount. Every time someone perforates and punctures the heart, I mean, obviously it's a very serious occurrence. It could mean death for a patient, but it could cost even in a safe result, it still could cost the hospital thousands and thousands of dollars by bringing in more physicians. If that happens during a case, you probably have to rush in an interventional cardiologist into the case, which is going to cost more. Any other complication from that, it's going to cost more. It's more and more, thousands and thousands of dollars out of pocket, out of the hospital's pocket, that could be avoided by using a safer system. So that's where I focus on the value. You have to think that way, guys. Every time you're saying something and you're practicing in your sales calls, I don't care how experienced you are, you got to have that. Okay, so what does this mean? What does this mean for the doctor? What does this mean for the patient? You should be doing this for every time you're selling a product. And think about that. What does it really mean? And if your examples in your head aren't really that impactful, if they don't make you say, yeah, I actually would definitely use this because of that, then that's not real value. It's got to be valuable to you guys. And you got to think that way every time. What's it to the patient and what's it to the doctor? All right. So when you're just going through that, make sure you're thinking that on every time you're looking at these different scenarios. All right. So next, on top of selling value, we can't just go in there with one message. You have to tell your message depending on who you're speaking with. When you're in the hospital space, you're not just calling on doctors all day long. All right. There's other personnel that are in there. You also dealing with administration. That's the C-suite level. You deal with procurement and finance, and you're going to deal with the nursing staff too. So it's a different approach to the clinical side. So for doctors, it could be, I care about better clinical outcomes, less procedure complexity, and improved workflow. For a nurse, it could be reduced workload, safety improvements, or ease of use. Now, totally on the other end of the spectrum, we look at procurement and finance. They care about the ROI, the total cost of the procedure, and then having a predictable supply chain. And then lastly is administration, the C-suite level. They definitely care about lowering overall cost. They definitely care about improved metrics that are tied to reimbursements, like HCAP scores, or CMS penalties that you can get. So that's very important. You have to know who you're speaking with. Can't just go out there and say, I'm bringing value, and then you're talking all about clinical outcomes when you're talking to a CFO. Trust me, I've had these conversations, and I've done that before where I'm reaching to make a connection with the whoever the customer is that I'm dealing with. If I don't have my talk track in the right bucket, it's going to go on deaf ears. If you talk about clinical outcomes all day to financial people in procurement, in finance, trust me, guys, they are not. It's not that they don't care, but they care about the costs more than that, because that's their job. Their job is to control cost. Their job is not clinical outcomes. That's what doctors are for. And same the flip side with the doctor. If you're just going to talk about cost all day long, it could be an attending physician that at the end of the day doesn't care that much about how much it costs. That's not his job. His job is outcomes. So you got to focus it that way. That is key, guys. Know your customer. You have to know your customer before you deliver your value, because the value means something different to different individuals. So nice practical way that I like to think of this is the 3 Ps. The 3 Ps are patient, provider, and payer. So for the patient, how does this improve patient safety, satisfaction, and outcomes? For the provider, how does this help the physician deliver better care more efficiently? And then lastly, to the payer, how does this align with reimbursement models and reduce costs? Again, you got to keep those 3 Ps in mind anytime you're making a sale within a hospital system. Again, patient, provider, payer. All right. So I know we're going a little quicker than normal on these calls. And James, if you're there, if we can cut and take a break and see if there's anybody from the crowd that has any questions, I appreciate it.
No, Joe, I disappeared on you. You're all by yourself.
I like when you're silent back there, man.
Well, I mute because I'm a mouth breather. And
yes. No, but please tell me, anybody have any questions, any thoughts, comments?
Yeah, we got a couple. We got one right here from LinkedIn, Jinju. If the hospital like your production in the POC, how can you integrate with existing EMR, EHR like Epic, Oracle Health they had?
Okay. How can you integrate with existing like Epic, Oracle Health they had? Jen, I'm sorry that I don't really understand that question.
Try rewriting it in the comments, and we'll circle back to that.
Yeah. If you could rewrite that, because that's a little confusing the way it's written there. Appreciate it.
Myself, we'll come back to that. Jen, rewrite that. We got. Let's see. Joe, this is a good one. Can you walk through an example of turning a feature pitch into a patient outcome conversation?
Yeah, and that's a great question. One of the key things you have to do with all these conversations, guys, is make it real. Any real stories that you have, the more realistic that it is, the better. All right. So when you can talk about individuals that they can relate to, when a doctor can relate to a certain patient, paint that picture first. I had many instances where, for instance, there's a great example of selling this nasal mask. And the nasal mask was basically used during procedures with heavier patients. So BMI of over 35. So BMI of over 35 is high. Patients, have a lot higher BMIs, but anything above 35 is, just so you know, it's a high BMI. So when you paint that picture and say, here's a perfect example, not just your patient will be safer using this mask. And a lot of reps will come in there and say, it's safer to use for your patients. Okay, that's great. All right. But if I really dig deeper and tell the story, where we had a patient come in, perfect example. We were at Robert Wood Johnson. We used our new mask on this patient that had a BMI of 60, very big patient. We could barely get the patient, could barely fit on the table, had all kinds of other underlying and exposed health ailments going into this case. But we were able to quickly get the mask on, do the procedure. Their oxygenation never dropped. The patient was safe the whole time using our mask, and it enabled the physician to do other things during the case, so he wasn't constantly worrying about that patient on the table because he knew he was safe with the mask. So at the end of the day, he was able to do more procedures because just popping this mask on enabled him to not have to use different techniques that he would have to do manually, which cost him time. So at the end of the day, he was able to do multiple procedures and have that same safety with all his patients, which increased the volume of doing an extra 2 cases a day, again, which results in X amount of dollars. All right. So this is one example of taking something that is a simple safety issue, but relating it back to the patient, where they're safe, their oxygenation is not going to drop, so they're breathing without you having to do anything. And then you're adding more cases to that patient, that physician schedule, where they're able to bring in more revenue. And that's just a simple example.
Let's see, we got Joe. How much does reimbursement or insurance coverage play into patient outcome discussions?
I mean, very, very important. I mean, let's be real, guys. It's all about patient outcomes, but it's also about money. If physicians, hospitals, clinics, if they're not going to make money, they can't do procedures. They eat procedures a lot. They eat a lot of costs. In a lot of hospitals, if they didn't have endowments and other ways of getting money into the system, it's very hard to keep a business going. But if you're doing procedures that they're great, all they do is they provide safe outcomes, but it costs the hospital 10 times what it costs the competition, they're going to be out of business. They're not going to be able to do that. So you have to be realistic too. Yes, it's all about outcomes, but if the ROI isn't there, they will not do those procedures. They will look elsewhere to figure out ways that are cost effective and also are able to provide great outcomes. So it's outcomes is always number one, but it's a close number two. So you have to make sure that you have that as a part of your answer for some of the challenges the hospitals are having, or they'll never use your product.
Is there a difference between outcome-based selling and solution selling?
I mean, for me, outcome-based selling is very similar. I'm sure there's things that I'm not thinking of off the top of my head that I could talk about the differences. But at the end of the day, it's go in there with your solution should solve some sort of problem they have. Your product, should be a solution to some sort of problem they have. And I've had products that were cool, but they didn't really solve a real problem they were having. And if your product doesn't do that, they're not going to use you. So a solution and what was the other way they phrased it?
Solution or outcome-based selling.
Yeah. So to me, it's the same thing. We're talking about outcomes, meaning positive outcomes. So if it's providing positive outcomes or providing a solution, to me, that's the same thing.
Okay, we got. How do you approach a doctor who only wants to hear about product specs or pricing?
Then you give him what he wants. It's just that simple. I mean, you still got to tie it back to the patient and to the physician. But if there's someone that is a more numbers physician, and I've had this where like we were talking about before, where you always have to have, you have to know your customer. You have to know who you're speaking to. All right. Now, again, until you ask those questions, you still don't know what the drivers are. So, like I said before, for instance, if you're going into a financial talk with a CFO person, you would assume it's more about the ROI, the costs. Okay. And the flip side, if you're talking to a doctor, it's about the patient outcomes, the safety. But sometimes you do speak to physicians that, they're running a business. So a lot of times it is going to not just be about patient outcomes. It's going to be about the cost, especially if they own the practice or if they're a partner in a surgery center. They're not going to just say yes to anything you sell and charge whatever you want to charge. Cost means something. It's the same as in all our households, guys. People can't come up to you every day and say, Joe, you want to buy this? Yeah, I don't care. I got money. I'll buy whatever you want. No, we all have a budget that we have to work in. And so that's important. So you have to make sure that when you're asking these questions, you don't just get out and just start spitting out value that might not have to do with that doctor. So if that doctor wants to talk about more numbers-based, more statistical, wherever that physician wants to go, wherever that customer wants to go, you have to be able to go in that direction and then provide value based on wherever the conversation led. So basically, don't assume is what I'm saying, is that, you're going to be very prepared, but you got to be prepared to go in different directions depending on where that conversation leads you.
Is ROI different when talking to a physician versus an IDN or GPO?
Yes, it could be. It could be the same. It could be different. But again, it's very situation dependent. All right. So the doctors do work for IDNs. So Dr. Jones could work for, Hackensack Barnabas. That's a big IDN in New Jersey, where he's a physician that works under that umbrella of that IDN. So at some point, it has to, it affects the doctor. If he's working for that IDN, it also affects the IDN. Now, you could argue if he owns his own practice, would he care more about certain things and the numbers he might, it's like, again, owning your own business versus working for a medical device company. A lot of you out there would say, well, I treat it like it's my own business. Guys, until you actually own your own business, it's not your own business. It's just not. There's things that I just can't do every day and just spend money just because, I have a business. I have to think about things, a little bit more. I have to scrutinize more than a multi-billion-dollar pharmaceutical company that could spend hundreds of thousands of dollars on speaker programs or flying people out for a meeting and spend $500,000 to get people out there. Now, obviously, having a small company, you can't do that. So, but it's important though, depending on that doctor, depending on that situation, it could be different. The doctor, now that it's its own practice, cares more, and really wants to talk about the numbers and really wants to talk about that ROI. But if the doctor works for a large IDN, might just be, hey, you know what? I care more about just the patient outcomes and the outcomes for my patient, and I'll let someone else deal with the actual numbers. But I really want to get this system in. Now, if it's coming out of his pocket, he might say, you know what? I might back up. So it really depends on the situation, because sometimes it could be the same and a doctor could think the same as an IDN and sometimes not, and when you're dealing with GPOs, so we're dealing with group purchasing organizations, that's a little different. All right. Their job is to get the hospital the best price. That's basically it. Of course, the products have to do what they say they're going to do. But when you got 3 or 5 vendors all trying to get whatever it is, their product into your hospital, a lot of times, guys, they're dealing with a lot of Me Too products. Sometimes they do have benefits where the GPO will say, you know what, the hospital's going to have to spend a few dollars more because they really need this. But again, It's going to be about the value. What does that extra spending really mean to the hospital and to the doctors and the patients for them to spend a few extra dollars? Because more often than not, those GPOs, their goal is to keep costs down as much as possible. They get paid off that, right? They keep the costs down. It's better for the hospitals. It's better for them. So a lot of times the conversations are going to get a little bit, it's going to be more driven by cost. Usually, if two products do the same thing and one is a lot cheaper, that GPO is always going to go with it. So that's a little different. It's going to be, with GPOs, it's always going to be a little bit more about the dollars and a little bit less on the clinical side.
We got, Joe, how do you handle situations where products ROI isn't immediately obvious, like long-term patient compliance or reduced complications?
If it's not immediate.
Yeah, it's not immediately obvious.
Yeah, and that's what you got to help. That's the key to selling. I mean, you got to help your customer understand that it's, sometimes they don't see the results right away or the reason why they're doing this. That's your job as a sales rep to let them know why they're doing this. Like when we were selling those robotics, they just saw the dollar amount, the sticker price, said, no, we don't have the budget for that. We're not going to do that. But when you start showing them, yeah, but what if we could show you that you're going to bring in X million more into your hospital budget by next year by getting all these new patients in there. Excuse me. That changes everything. It's, if you own your own business, you own a restaurant and you're not going to serve meat. You just serve fish all day long. And then you say, hey, Joe, well, we don't need this new meat making machine because what's the point? We don't have the budget for it. Yeah, but if we put this in there, we put a grill in there, now you can serve all these hamburgers, hot dogs, steaks, and now you'll be able to attract X thousand amount more people, which will bring in thousands more a week into your business. Now all of a sudden you see the ROI and it's more of a long-term purchase where might not have the money today, but we know we need this because a year from now it's going to bring in all this revenue. That's how sales gets done in these hospitals with a lot of these big capital products. A lot of times they don't have the budget or they don't see why they should be doing this today. It's not about today. A lot of times it's that ROI over a time period that you have to sell them to convince them to purchase that, which is not easy.
What's the biggest misconception reps have about outcome-based selling?
Is that everyone thinks that all the outcomes are the same. It's getting back to knowing your customer. So they go in there assuming that everyone should care about this, whatever the topic is and whatever the value that they think is valuable. So one of the key mistakes that people make, and this is in all of sales, they make it about them. They make it about, well, when your company tells you that everyone's going to care about X, Y, and Z, the data shows it. We do all this research to show that doctors care about these three things. How come I'm telling these doctors this? It doesn't look like they care. Well, because you're not asking what that customer thinks. You got to ask what's important to that customer. I mean, if everyone just does that when they meet someone and just say what's important to you, that's something that majority of sales reps do not do. They go in there laser focused with the messaging that they were told by the company or that they prepped in their car or, whenever they were doing their preparation, say, I have to talk about this today. I'm only going to get 30 seconds. I know this guy, he always walks by me real quick. He only gives me 30 seconds. So they feel like I just have to get the messaging across. And you could do that same messaging month after month after month and go, how come this doctor doesn't use me? Because the messaging means nothing to that doctor because you didn't ask them what they value. And that's the key. Don't assume that just because the company says it or because the data shows it. You have to find out what really means, what's valuable to that specific individual. And the only way to know is asking the questions. So make sure you don't make that mistake. Don't get the new shiny detail aid or the new sales approach that everyone practiced in training last week and dive out there in front of doctors and say, I just want to use this on them. Because sometimes it's exciting, guys. There's cool detail aids. There's shiny new, tools that they give us that we want to get out there and use it. But you will make a mistake, and everyone does this. I've done this tons of times. Make sure you're talking to that doctor or that customer and finding out exactly what's important to them before you get into, your actual sales approach.
We got, what's one patient story that changed how you sell forever, Joe?
That's a good question. One patient story that changed. Give me a sec.
Start playing the Jeopardy music for you.
Yeah. There's just so many, but you know what? I think it's overall when I worked at Boston Scientific, that was my first real hands-on approach with patients. All of us say, well, I love being in healthcare because I love to see how my products help patients' lives. And yes, that's true and that's great. But there's a lot of drug companies out there. There's a lot of med device companies out there where you never see a patient. It's just real. You're dealing with doctors or other clinicians most of the time, or even buyers, and never even see doctors sometimes. But this was something where it was hands-on with the patients. So I had tons of different stories of patients that I saw this device for their spinal cord stimulation change their lives. And for me to see the impact and have a patient that one day couldn't walk. There was a patient in a wheelchair that just had such bad nerve pain, they could not stand and walk. And they had our system in them for only 3 days. And they were able to walk around. It was mind blowing to see. A lot of us see these videos online and, someone who has Parkinson's, their hand's shaking, they put on that new device and everything stops. Or, the babies that can't see, they put the glasses on and you see the baby smile, but when it's real in front of you and it's one of the patients that you're working with and you were a part of that procedure and you see that like, wow, Mrs. Jones went from not walking 3 days ago to now running around, and you see how happy she is. You see the impact. She's able to pick up the kids now. She's able to help with her grandchildren where she felt like she was worthless, and to be like, wow, this not only made a difference in her life, made a difference in her family's life, and it affects all these other people. When you could see that changes your whole perspective. There's one thing to say it's always about the patient, but when you actually work directly with patients, it has a whole new meaning. It becomes real, really real, because you could pick a moment of when something happens to you, see that patient, you see Mrs. Jones, you see Mrs. Smith, whoever it is, and you're like, wow, like this really is that important. So that's what doctors see every day. When you get a small taste of it in this job and see that, it's going to change your outlook on how you sell, because it is going to open up what's the real value here. I would never think, well, now after you get this procedure, I think it eliminates your pain. No, it means that it enables her to walk her dog again. It enables her to pick up the kids from school, to throw the ball around with her grandson. These are the things that are in my head now, not just relieving pain. It's the things that she talked about that she wanted to get back to. And that's the real value. So I hope you guys, get positions where, you're dealing with a heavy patient interaction, because it's stressful. Don't get me wrong. There's days that you want to go, I don't want to go to work today because patients are yelling at you that something doesn't work or they're unhappy. There's always challenges, guys. But overall, it's the most rewarding feeling to see firsthand the positive effects of these drugs or devices.
Yeah, it's got to be pretty cool and rewarding.
Awesome. Yeah, it's really cool.
That's pretty cool. What tools are there any tools or data sources that you rely on to prove patient impact?
Yeah. So the more data that you have, the better. When you're in any of these calls, you don't want to load up, get every white paper, every clinical study, get it and go, hey, doc, look at all this info I got for you. This is all the proof of why you should use this, and throw it in front of the doctor. I mean, guys, if there's ever been a guarantee that everything's going to get thrown in the garbage, that's the right way to do it if you want that to happen. But to have that clinical data, the more data, the better to back it up. But you got to focus on one or two specific points that you want to get across. All right. But to have the clinical data, and especially a large study that shows the validation, all the, that of what you're talking about, and say that, yeah, my product does reduce cost, or my product does improve the efficacy of whatever, or reduces whatever adverse events. And then you have the data printed out to point to the doctor and say, you could see it right here. Out of 50,000 patients, only 2% had, bleeding, or 3% had nausea. I mean, that's more impactful because they know that this is real data, that the studies have shown that. So the more that you can show that, but get to the point, again, just don't overload and stop and dump all this info. Get to the specific point, but that backs it with that clinical data from a study or a white paper, especially if it's a prospective study. There's a big difference. There's retrospective and prospective. And if you have a prospective study, make sure, that's something you guys should salivate over when you're presenting with any of your clinicians. That means that they had a purpose in mind with this study, and the study lived up to the expectations. A retrospective, a lot of times it's like, holy shit, I didn't know it would do that. And then they build a study around that. Oh, it does reduce side effects. Damn, I didn't know that. I thought it was just cheaper, right? And then they create a retrospective study based on the info, but they weren't setting out for that. They were totally looking for a different end result. So a prospective study is something that if anybody has those in their hands, you have to let the doctor know that this was a prospective study. That is a big difference. That means you had a goal and it actually lived up to that goal.
Okay. What does collaboration with clinical teams play in validating patient outcomes?
Well, you have to have a collaboration with clinical if you're gonna get patient outcomes. It's just that simple. You need to the key here is obviously you can't get patient outcomes without having someone clinical in that setting. There's got to be a physician, a nurse, someone to help you get those outcomes. But the key is to align those, like we're talking about, which is a perfect segue. You should know prospectively what the doctor is looking for. And that's what we're talking about at the beginning of these calls when you're asking questions. What are the outcomes that you're looking for your patients? Just that simple. So now you know what the end result he's looking for, and now you have the data that actually gets you there, or you have the product that gets you there. That's huge. So to have those clinical conversations, that's the key, is knowing what are the outcomes that they're looking for? What do they care about? And then aligning your product to help them achieve those outcomes. That's the key.
We got a question on LinkedIn. Not really with the topic today, but still, Nicole Kokas, can you give advice on how a successful sales manager / leader who wants to get into medical sales field?
Yes, and we could definitely talk about that. But the best way to do that, because we can go off and spend a long time, that it's just not the appropriate time right now for this call. But please make sure that you book an appointment via my LinkedIn page. Or just go right onto my website at RepPath.com, schedule an appointment, and then we could discuss to help you and show how the RepPath Academy and our other services can help get you there. But I appreciate that, but it's just too hard of and long of a topic to get into right now on this call.
We got let's see. How does patient outcome differ from pharma versus medical device?
But again, it's not so much about pharma and device. It could depend on product to product. So it could be different outcomes depending on different pharmaceutical products, different outcomes, for medical device products, or all in between. There's not something that is a pharma specific. If anything, they're going to talk more on the pharma side about side effects and adverse events. Those are key things. No matter what you're selling, of course, adverse events are going to be key. But when you're dealing with pharmaceutical products, it's side effects. So if you have a safer side effect profile, though, you're going to hear that a lot. What's the side effect profile? That means, what are the different rates of different side effects? Is it 5% nausea versus 2% nausea? This is how pharma companies a lot of times sell against their products. They take the clinical data, all the studies, especially a lot of their information from their package insert, and then whoever has a safer, healthier side effect profile, that's a key advantage. You're not going to talk about that so much in device because you're not dealing with a drug. Okay, so it's not so much about side effects, but at the end of the day, it's going to be about the outcomes, and you're also, at the end of the day, side effect profile or not, do those side effects in the pharma side, if they're not that positive, even though the end result gives people, whatever they're looking for in that medication, but if the side effect profile isn't that good, you're probably going to have poorer outcomes. Not all the time, but it could result to other outcomes. So for me, to simplify, side effect profile is more for pharma, and then end result outcomes is both pharma and device. That's the only real big differences I can think of off the top of my head.
We have, why do you think so many reps get stuck selling features and not the impact those features have on patient care?
I think a lot of times, people do get confused on what is the actual, what's the difference between the feature, the benefit, and the value. And a lot of times they think that those features equate to value for, the same amount of value for different physicians. And they don't. A lot of times they don't. Could be the same thing for two physicians. It might be totally two opposites for two different physicians. So you got to know if that, quite frankly, do I give a shit about this feature? Does it mean anything to my customer? Only way you know is asking that. And a lot of times people just think, I did a good job today because I talked about the features and benefits. Doesn't mean anything, guys, if that feature means nothing to that doctor. So that's the key. You want to make sure, I've said this over and over on this call, you have to make sure you know what the key drivers are for your customer. And the only way to know is by asking the questions ahead of time. Got to be in those calls, asking a lot of questions, learning. Don't focus so much. And a lot of us do this. I did it a ton of times. When my manager was with me and you're on a ride along, you feel like that manager breathing down your neck, and you start saying like, shit, I got to talk about the product today. Got to make sure I mention our three features and our three benefits on every call. And a lot of times you get in this, you're basically a walking billboard. You don't want that. For me, my teams, I didn't care if you talked about the product at the first encounter. I don't want you to. I want you to get in there and talk to the doctor about what is important to them and their patients and their practice. And that'll dictate where it goes. So a lot of times people don't do that. They just throw out features, and that's what they fall short because they go, I'm not making any impact, and I keep getting in there talking about these features. Again, when you're asking yourself, what does it mean? What does that feature mean to the doctor and the patients? And you can't answer that question unless that doctor told you that. The only way to know is by asking them. So go out there and say, well, after you give a feature, what I would ask is, don't just assume, so then it does this. Like, if I got patients to get 50% of a better side effect profile or 50% less nausea, what does that mean to you and your patients? And just stop and let the doctor answer. Actually, they might say, Joe, I don't give a shit if my patients throw up a little bit. That's part of being on birth control. That doesn't matter to me. What I care about is the efficacy that this drug is going to work, and they're not going to come in here pregnant. That's what I care about. They could say that. I don't know. But until you ask that, you don't know either. So make sure you're asking those questions and they say, what does it mean to you? And I'm telling you guys, it's going to be eye-opening because you're going to see a lot different answers than you expected or than you anticipated when you went in there.
What's the biggest mistake even experienced reps make when talking about outcomes?
That same thing. They assume that the doctors are, everyone's answers are the same. And they go in with an assumption that doctor's going to care about this. This is something that's great. Yeah, all the doctors are going to care about this. You get out there and it's like, how come it doesn't work the way I thought it would work? And that's what life is. I mean, you don't know until you're in that position. So that's the big mistake, is that assuming just because the company spent money on this, just because it sounds good, or a few physicians said, because a lot of times what happens, doctors come and they do, they'll consult for a company and they'll say, well, yeah, doctors really care about this. And they could be right. But a lot of times that's not the case. They care about this. That one physician cares about this, but it's not as important as the next doctor. The next doctor say, yeah, I care, but it's like number 3 on my list of priorities. Next doctor would be like, I don't care at all. So it's taking that, one piece of information or taking something a company tells you, running out there, throwing in front of doctors. Again, don't do that. That's a big mistake. Learn what the doctors want first, and you'll avoid a lot of those misperceptions that gets people in trouble, and they can't move further in the sales process. That to me seems to be the biggest mistake.
How do you prove that better outcomes translate into measurable ROI for your hospital or practice?
Well, you got to have the data. I mean, that's the key. That's why, the more data is king in this industry. It's king in most industries. But when you have that data to show that now you have your systems in 10 hospitals and you have the proof. This is what we did. We had the proof when someone got our robotic system, and then in 6 months to a year, how many more cases they were able to do at that facility. I mean, that's a true test of, okay, without us, they did this amount a month. With us, they're doing twice as much, or whatever the numbers were. We can easily say it's because of our system, because here's where it was at one point, here's where it was, months later. So you have to have that data no matter what you're trying to sell. If it's implementing a new system like we were doing, or if it's reducing readmissions, if it's reducing hospital stays, adverse events, you have to have the data. Most companies are very good with this, especially if they want to sell in the hospital space. You have to have that data. But once you have that data, the key is to be able to sell that to your physicians and let them know that, hey, here's the proof. If you have that proof, it's really tough. The more proof that you have and validation of your product for customers to say no. Because if they do say no, then well, maybe that's not the real reason why. Because we're showing them the proof and handling that objection, but they're still being negative. Then that means you just got to dig a little bit further, and that might not be the real reason of why they're not using you. But that data is key. The more data you have, the more that you can show proof of your system or your product, the easier it's going to be to sell.
All right. The last one I got for you today, Joe. How can reps reframe a feature into an outcome statement in real time?
Again, come back to what does this mean for the patient and what does this mean to the doctor, and then work backwards. It's the best way to do it. If it's simply, for me as a doctor, if it could reduce patients from calling me late at night, holy shit, yes, that's value to me. It saves time, personal time with my family, because I don't have 20 patients calling me every night. That's key. And the feature could be the low dose estrogen that results in fewer side effects. All right. But again, what's the value? More side effects means more people are calling that doctor. So now that you're going to reduce those side effects, you're essentially going to be reducing the number of patients that are calling that physician. So that's flipping, taking the feature, which is low dose estrogen, and now bringing the value of more quality time with your family, less people interrupting you. That's the value. So that's a quick way to flip that. Think of, what does it mean to my customer? What does it mean to the patient? And then work backwards, and you'll be able to get your answer.
That's all I got for you today.
Awesome. Well, thank you for that. Thank you for fielding all those questions, James, and a lot of great questions, guys. For any of you, please, for some of those conversations that are going to take a little bit longer, please just go on my YouTube, my LinkedIn page, and book a call so we could discuss that. But again, more importantly, guys, for any of you individuals out there looking to break into the industry, make sure you're joining the RepPath Academy. It's very simple. Just go on that RepPath website. It's easy to follow to get signed up there. And for any of you members out there that are lobby members, please message me with the promo code Licata, Licata. And so when you do sign up for the program, it will entitle you to additional discounts, which we can discuss on the call. But please make sure you're using that promo code Licata. And anyone else, please, very easy to use system with our website. Just go on there. You could see the companies that we work with. You could see the recent testimonials from individuals that have broken into the industry in as little as 3 weeks. So, guys, thank you again for listening today. Thank you again for joining us. We're going to be here every Monday and Wednesday at 3 p.m. Eastern. So I look forward to speak with you guys soon. Have a great week. Yo, buddy.